Hi students, this is Jamie, and I'm going to make you a podcast to talk about our upcoming lab weekend and the skill check and the little comments on the written exam. Few people have emailed me asking me what's the skill check going to be like, how can I prepare for it, and I figure instead of typing it all out, you can listen to me explain it with my voice. If you want to stop this recording and get a pen and a paper and to write, and also get your O'Sullivan book out, that would be fantastic, because I'm going to be referring to certain pages, and if you had your O'Sullivan in front of you, you could see what I'm looking at, and we could be on the same page, literally. Aha. Okay, hope you guys are doing well. Now, the skill check is okay, what can I say? So I've taught for 11 years and I've never had a student fail this skill check. Okay? It's not a hard skill check. It's a pass or fail. If you don't get it, then we're going to ask you to do it again. But it's not difficult. And what it's on all the things that we learned about and you practiced last lab weekend. So it's on combined cortico testing. It's on non-equilibrium and equilibrium testing and some balance. So all those things that you worked with last weekend is what it's on. And how this works is the first thing Kathy and I are going to do is we'll call you in one by one to kind of a private area. And the first thing we're going to have you do is you're going to pick a card, literally. We've got these 3x5 cards, and on the 3x5 cards are written the combined cortico testing that we did. The stereoagnosis is on one card, 2-point discrimination, double stimulation, graphesthesia, recognition of texture, baryognosis, all those graphesthesia, all those ones that we worked on last lab. There's a card for each one of those, and you're going to simply pick a card. And whichever one you get, let's say you get stereoagnosis, then you're going to, Kathy and I are going to be your patient, and we're going to sit down in the chair. You're going to explain to us what you're doing, what the test is, a little bit about maybe why you're doing it, and tell us what we should expect. You guys remember that. So we're not doing hot and cold, but for instance, if we were doing hot and cold, you'd show the patient this is cold, this is hot, you describe the instructions, have the patients close their eyes, and so that's what you're going to do. You're just going to demonstrate for us that you know how to do this. You're the PTA, we'll be the patient sitting in a chair, and this is going to be very quick. So you pull the card, and let's say you pull stereoagnosis, then you explain it to us, you do the procedure, you have us hold out our hand, you put an everyday object in our hand, we have us close our eyes, and we're telling you it, and then that's done. That's it. So that's one part of it. The second part we're doing the skill check on is on the non-equilibrium tests. And these were the ones, there's the chart that you got the handouts in lab, but it's also on page 221 in O'Sullivan, where it's the finger to nose, finger to therapist, all of those different coordination and balance for the non-equilibrium. But it would be too silly, I think, for us to do finger to nose and just tell you to show us. What makes more sense is that you know the impairment and you know which test you should do to test that impairment. So again, you're going to get a different stack of 3x5 cards, and in the 3x5 cards are the impairments that are on page 220 in the table 6.3. Dystodiacokinesia is one, dysmetria or dysmetria, tremor. So basically what you're going to do is draw one of those cards, and let's say you drew dystodiacokinesia. So again, you're going to be the therapist, we're going to be the patient, you're going to tell us what it is you'd like us to do. So, the possible choices for dystodiacokinesia are finger to nose, alternating nose to finger, pronation, supination of the hand. You could do knee flexion and extension. So there's multitude of different tests you could use. So, and we're going to kind of take it one step further. Not that you'd explain this to your patient, but Kathy and I are going to ask you if you had a dysmetria or dysmetria. We're going to ask you, can you define that for us? So you just tell us what it is, and then you're going to perform a non-equilibrium test on us that will look for that impairment. Okay? Again, quick, simple. All right, and then the last section that we need to do a skill check on with you guys is the balance. And for all of you to go through the Berg and the Tonetta and the timed up and go would really be time consuming, and it would take up so much of our lab weekend, and we've got other things we need to practice. So it's going to be an oral quiz. So out of all the balance tests that we worked on last week, we did the Berg, the Tonetta, the timed up and go, all the different ones that we worked on. We're going to have you again pick a card, and on those cards, and on the card is going to be one of those balance tests. So for instance, if you pull the Berg, you're going to tell us what the Berg is, how it works, what it tests. You're going to tell us maybe 2 of the things that you have patients do on the Berg. For instance, you might say on the Berg, I have the patient sit in a chair and I tell them to go ahead and stand up. Stand up as safely as you can. If you need to use the armrest in order to get up or for safety, you can. But try and see if you can I'm getting too wordy here. Let me think of something easier than that. That's too much. Part of the Berg is eyes open, eyes closed, standing there. So basically, you're just going to explain a part of the Berg to us and then demonstrate how you would do that. Sorry, I got kind of wordy in there. Same thing for the Tonetta. What is the Tonetta test? One side of the Tonetta form tests balance, and the other side tests gait. How could the Tonetta be used with your patient? Well, the Tonetta can be used in a number of ways. The Tonetta can be initially used by the physical therapist at eval, and then that can give you a score. And as a PTA, you could look at that score and you could look at different areas that they had weakness on, and then use those as treatment. If they had difficulty coming to sit to stand, well, maybe that's an area that you need to work on. And then the Tonetta could be used again a week later to see where they're doing, to see if they've made any progress. So it's just orally you're going to tell us. If you pulled the card timed up and go, you're going to tell us how the timed up and go works. What kind of equipment do you need? How does it work? So just an oral, all right? Because what's going to happen is when we get to the final weekend of this course, you put this all together. So you're going to get a case study, a patient eval based on one of the diagnoses that we have talked about, and you're going to have to do a whole treatment. And inside there is a balance piece to that, so at that time we'll be able to see you actually perform maybe part of a Tonetta or a Berg. But this is just a quick skill check, so it's just a pass-fail. So that's all there is to it. There's no soap note that you have to write. This really should take 10 minutes, 10-15 minutes per person. And like I said, you'll just come in one at a time and meet with us. And I know the South Sounders, you guys are going to finish that case study, so while Kathy's doing the skill check, you guys could be on the other side of the lab working and finishing that case study so that you can return that in and get points. My lab's up here. I've got something that they're going to be working on, kind of a worksheet, so that this isn't downtime, because it would be... It's just more time efficient if everybody's working on something rather than you guys are just sitting there just hanging out while Kathy and I are calling you in one by one. So we've got an activity plan for both groups to be going on at the same time as we're doing this testing. So that's how the skill check is going to go. So I hope it's not going to panic anyone. It's just a great way for you to pull it all together. You know, you practice the test. Well, first you read about the tests, and then you saw some videos on how to do the tests, and then you practiced the tests, and now you're kind of pulling together the tests with the impairments, with putting it together on how it would work on a patient. So a very quick skill check, 15 minutes each student, and again, pass or fail. The other thing I wanted to talk about was the exam. So I've made a study guide for you. And I've also made like some key questions here in the pediatric material. A couple of you, well, no, that's not it, is it? Sorry. I guess I put it in the study guide. Sorry. I was thinking I stuck it in there. Where is the study guide? There it is. Sorry. So I made a study guide for you, and because it's going to be busy in lab this weekend, and so you really need to use this study guide and review yourself. And I really want you to go through, and you guys know me, if you answer these questions and you study them, you're gonna do well in this exam. It's giving you key parts to look at, pulling you to information. These are the learning objectives, and I even included the answers for them as well. So this is a very nice study guide. So if you've read the chapters, you've watched Margaret's lectures, you went through the PowerPoint on stroke. The other thing that I want you to know, oh, where's Anya? Anya, are you listening? I know there's probably some South Sanders who are like this too, but Anya loves to know exactly how many of which type of question. I love that, Anya, and I love if any other South Sounders, here you go. This will just make Anya's day here. There are 28 multiple choice questions. There are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 matching questions. And I kind of grouped like the reflexes together in like a big matching. So there's a big matching section. And then there's a short answer section where there's about 8 short answer questions. And the short answer questions are based from the PEDS and the CVA. And the one thing I have added that is super helpful, let me see, not that. Sorry, I got to go back into our modules, is I added a practice quiz right here, linked to the practice quiz. And so you go here, show all content, click here, and now you can go through, so like if you want to quiz yourself for chapter 5 or cerebral palsy or stroke, you can click on these and it will give you questions, and you can quiz yourself. A lot of these are the same questions that are on the exam, are very similar. All of the short answer questions are from either the study guide that I made or right here. I took them straight off this practice quiz. I took them straight off of the chapters 5 and 6. So if a really good way to practice would be to take these practice quizzes, and if you haven't noticed, these practice quizzes fall right in line with, at the end of the chapter there's a series of questions. They're the same questions pretty much that's in these quizzes, so you could probably do those questions and then take this quiz. This will really help you. Okay guys, I hope you're making your way through the material. It's really quiet, and that makes me really nervous. Does that mean, I know you've got these great videos from Margaret and maybe things are just making sense, and you don't have a lot of questions, but gosh, please don't hold back, and wait till like Friday night to try and email me a question. I'm available this week, and next week I have lots of time on Monday, Tuesday, Wednesday to return emails. So I just really support you in getting through the material and asking me questions early so that I can help you. And the other thing about the case study, I've gotten one turned in so far, which is awesome. And typically these are taking students about an hour 15 to do. So it's a lengthy assignment. So again, you don't try and do this case study like a half hour before it closes on May 14th, because it's a lot. You're watching the video and you're analyzing, and then you're coming up with treatment plans, and it's quite a bit of work. That's why there's only one, and it's worth 25 points. So make sure you plan accordingly to that, because it's not something you can just rush through. All right, you guys, I hope you're having a great day, and I hope this helps with some anxiety some of you had about the skill check. See you later.